Ever have chapped lips?
If your lips are dry and cracked like this, then never peel them off.
The kind where it's raw, cracked, and flaky, where no amount of lip balm will fix that. That's because dry lips that some people even make a habit to peel.
Can one of my ADHD friends out there tell me why do we pick our lips like this?
Is a sign of something deeper that is wrong. But it's commonly dismissed as just dry lips. And for some odd reason, people like posting themselves peeling their lips. But scroll through TikTok and you'll see real doctors telling you the opposite. Don't pick them, but focus on moisturizing. And don't lick your lips.
I'm a dermatologist, and if you have dry, cracked lips that's really irritated, these are the things you should and shouldn't do.
Unfortunately, that doesn't always prevent the next episode of dry lips. And then you got doctors saying that the corners of your lips, when they crack, it's not just dryness. It's a fungal issue.
This is not chapped lips. These are also not chapped lips.
And hey, that's my expertise. It's all true. But the real question is, how did things get this far? Why are lips peeling now? Why is there a fungal infection now when fungi has been all over all of us our entire life without an issue? Sure, it's common to get fungal infections on your feet and groin, but it's not a normal, healthy state. It's like diabetes or high blood pressure. So many people have them, but does that mean that it's a normal, healthy condition? No, they are not normal states of a healthy body. Not everybody gets them as people grow old. And when you have these issues, it's a sign that your immune system is wavering due to inflammation. So in this video, I'll help you understand how dry, peeling lips, cheilitis, is giving you a window to the state of your immunity to get to the root cause, heal faster, and prevent the next episode. Because if all you do is put antifungals and lip balms, I guarantee it'll come back and affect other parts of your body besides your lips and skin. Soon, something else will be inflamed. Here's my model of a skin. Yes, I know this is food. And if you didn't already know, your body is literally made out of food too. So if you want to have healthier skin, you should think about upgrading your food and not just eat bread, noodles, and cake. The skin is made out of 3 layers: the top layer, the middle layer, and the bottom layer. The top layer is a crust. This is basically a corn tortilla. The middle layer is called the dermis. This is a whole wheat, actually multi-grain bread. And the bottom layer is a hypodermis. This is instant noodles. Worst thing you can eat. So if you've ever scraped yourself and didn't bleed, you're scraping off the epidermis because the dermis and the hypodermis has all the blood. Now, my son did that. He basically went outside in flip-flops without socks. His toe literally got caught in the cement as he went forward, and a quarter-size piece of skin, the epidermis, was off, hanging by an edge. And amazingly, it was such a big wound, a quarter size, that I knew as an infectious disease doctor, it would be susceptible to getting infected. So I basically kind of squished it together, grafted it with a Tegaderm after first washing the site. And then I left it there for probably a few hours. We took it off gently. We put some Meta honey and then sealed it again to keep it tight. And amazingly, the next day, the skin grafted itself back together. Again, he took the top layer off, the epidermis. The skin is actually alive. It's full of immune cells in all these layers. There are stem cells in your skin that helps it to constantly repair and regenerate when you take the epidermis off for one reason or another. So in this video, she's peeling off the top layer of the epidermis, the stratum corneum. There's actually a skin condition called acral peeling skin syndrome that is a rare autosomal recessive disorder that starts as infants, and their skin constantly peels, and it can look like this. But these videos are only peeling the outer layers of the lip. And anytime the skin on the lips are inflamed, we call it cheilitis. Now, if you have eczema, you may have dry, chapped lips too. And it's caused by eczema. It's called eczematous cheilitis. That's because eczema is an underlying immune problem that can happen anywhere in your body. And it can be induced simply because you are lacking nutrients like vitamins and minerals. It can also be compounded by external stressors. It just makes it worse, such as soaps and hand sanitizers. Now, when your immune system is lacking something, maybe it's lacking antioxidants like vitamin D, vitamin C, zinc, or magnesium, or maybe even certain B vitamins or a combination of these, your body can be more easily challenged and irritated by outside stressors or outside irritants like pollen or allergies to whatever you're contacting, from your makeup to your soaps. And women actually suffer more of this condition. Can you guess why? Well, it's because women are exposed to more allergens. Think about the makeup, the lip balm, the lipsticks, the sunscreen, even nail polish. If it touches your lips, can irritate it, right? You're exposed to all these chemicals. And what's worse is that healthy things like toothpaste and mouthwash, you know that tingling feeling you get after you brush your teeth? Well, that toothpaste has an irritant purposely designed in it to give you that tingling feeling. Now, that is actually not a healthy feeling. There is nothing in that ingredient that will get your teeth cleaner. And here are some irritants in toothpaste to avoid. Now, once your skin is irritated, everything else will just make it worse. Now, a few years ago, I was exposed to cinnamon essential oils by accident. It burned my mouth. Even though it was just one exposure, I actually suffered from irritated mucosa in my mouth for several weeks to over a month. And that's because after I was sensitized by the cinnamon, everything else just compounded the effect. And ultimately, the problem was I was reintroducing trauma by using an irritant in my toothpaste. So my mucosa didn't have a chance to heal. I never had a problem with that toothpaste, but all of a sudden I couldn't tolerate it anymore. And then it made everything else that I ate even worse. So things that I used to enjoy, like mango and citrus fruits and pineapple, I couldn't eat those anymore because it would irritate my mouth so badly that I didn't like that sensation. So I had to give up those foods for a little while. And eventually it got to the point where I couldn't even drink water. Like there's something in the water I was drinking that gave me this sensation like something was going to happen, like impending doom. And if you've ever had anaphylaxis, I think you understand that sensation. I had to just give up everything. I changed my toothpaste. I cleaned up everything, gave up all the food that I thought was irritating my mouth, let it rest for about a month. I reintroduced things that I knew was healthy, like the mango, the pineapple, the citrus fruits, and now I can tolerate them without a problem. But I also tanked up on nutritional supplements to optimize skin healing. Now, when your skin is irritated, you basically have a wound. My job is to heal people's wounds, so I know exactly what I need to take to optimize my skin health. And if you want to know what I took, I have a link in the show notes below. I was able to heal without any further problems. The lesson was, if you are into natural products, you have to be careful. So just because it's natural doesn't mean it won't irritate your mucosa and your mouth and then make everything else more irritable to your body, especially heavy, hard essential oils like oregano, clove, cinnamon. So I don't want to just pick on natural products. Medications can also cause dry chapped lips, especially if you have an allergic reaction. So if you're taking medications, whether they're antibiotics or cardiac meds, well, if you are allergic to them, your lips may start to chap. And that can be one of the first signs that you're not tolerating the medication. But there are also medicines designed to dry you up. For example, retinoids. Lots of people take them from acne. Classically, your lips will peel. There are other medications that have dryness as a side effect, like antihistamines or diuretics, where they're purposely trying to make you dry. Sedatives, antipsychotics, decongestants can also make you dry and give you chapped lips. Again, once your skin is compromised, it'll be more easily irritated by so many things that maybe didn't irritate your skin before. So it's super important that you stop whatever you're using, makeup, or whatever you're eating to give your skin that break to heal. Do you see how dry this top layer is? Your skin gets dry when it's in the air, the heat, the sun, and this is the top layer of your skin, just like this. And so when you are exposed to wind or the cold, if you don't constantly drink and hydrate it, it's going to dehydrate and then it's going to break apart, like how this tortilla is broken apart. And that's why it's important to drink water, eat fresh fruit to keep the top layer moist so that you don't peel. Now, for this, look what I did. I actually microwaved it in some water. Look at the difference between this side, how it's wet and moist and sticky, and this side, how it's actually stronger, definitely stronger than this dry side or this moist side. So if you live in a humid environment, you may have an advantage over this dry climate, but if you start getting it too wet, you will break your skin apart as well. So the protection from climate needs to be optimal to help your skin. If you lick your lips too much, it can be like this, wet, moist, and then it breaks apart. And so when it breaks apart, what's going to happen to it? It's actually going to be compromise your integrity of the deeper tissue. So if this was on here, and if you had a hole, you would be able to see the dermis, right? If we put a hole in here, you would be able to see the dermis. And this is where you can get more infected. So we don't want to damage the epidermis with excessive water. So like when you're swimming or in a bathtub, or when you're licking your skin, that actually will be harmful, where you're going to be able to reach the bottom layers of your skin that needs to be protected from the environment. You can dehydrate quite rapidly if you lose your epidermis. Okay, that's like basically a burn. And you don't want this to happen, whether this is from licking your lips or you put some kind of allergic contact reaction where you're exposing your dermis. When you have an allergic reaction, so let's say you have, like a peanut allergy, a really severe peanut allergy where your lips swell up, the wetness doesn't happen from the outside. It actually starts from the inside. So these two layers, the dermis and the hypodermis, start to swell up, which then ultimately will wet this layer, right? Your epidermis. So it'll be like me putting this tortilla and the bottom gets wet first. Eventually the top layer will break apart. That's how some people blister, right? This can happen if you have angioedema and an allergic reaction, let's say to ACE inhibitors.
My cousin woke up with an allergic reaction because I forgot she was allergic to allspice.
And so when you break this apart, your dermis gets exposed. That's a pink layer. That's where you start having blood vessels. And that part you will rapidly not only lose water, but because this is a moist surface, you'll get infected so much more easily. Because on the outside, you have the stratum corneum, the layer of your skin that's dry. If you touch yourself, right, it's not all wet and sticky. If you actually lost the top layer, your epidermis, if you touch your skin at that point, it's going to be wet and sticky. And in order for this whole skin to come in intact, you have to give it a barrier, right? That you would have to put a Band-Aid over the dermis to allow the skin to remodel from below if the wound isn't so big, right? Once your wound gets really big, then your body may have a problem healing. And so when you do have an open wound, it does take more nutrients, takes more protein, takes more water that people drink, as well as vitamins like thiamine, vitamin C, and minerals like zinc, magnesium for your body to heal better. It's not going to heal without essential cofactors, essential structures to build collagen and repair that tissue again. But if you've ever had an allergic reaction, you know that the allergy doesn't just stay in your lips. It's throughout your entire body. That's because your immune system circulates throughout your body. So you may have an infection in your toe or an allergy like a bee sting on your toe, but then the angioedema, this swelling, will happen throughout your body, including your throat and your lips and your face, right? This is because your immune system is all over your body. And whatever irritant you have, if it circulates in your body, well, it's going to affect other body parts as well. Now, when you break this apart, so let's say this is my lip, and then you're spitting on it, okay? You're drooling. Why is that bad? Because that's actually wet, right? It keeps it moist. Why do you think your drool is bad? Because your saliva is full of germs. So if I put germs on this wound, then not only am I going to discourage the skin from healing, but I'm going to infect myself. And because now there's blood vessels on these two layers. There's really no blood vessels on the top layer, but the blood vessels on the bottom layer, now the germs can travel in the blood vessels, leave my lips, and go elsewhere in the body. It can affect your heart, especially if you have a heart valve or a pacer, or let's say you have a joint replacement. Any kind of hardware, any kind of plastic, it's going to go to because there's no blood supply around those areas. Okay, so if skin breaks apart, and let's say we put lip balm. So this is lip balm. It's basically spaghetti sauce, right? So I'm going to put lip balm on. And what's going to happen over time? It's just kind of a superficial, right? I'm going to even put it, let's say my lip cracked here. I'm going to put lip balm over that so that you can see there's lip balm. I'm going to take this off and it's still red. So if you put this lip balm and it reaches your dermis, well then if you're allergic to it, if there's an irritant in it, well imagine now you've contacted your blood vessels. So this now irritant can leave your lips and travel anywhere in your body and cause irritation anywhere else in your body. That's why it's really important that you know what ingredients you're putting in your makeup and your lip balm and whatever you put on your skin.
Hi, friends. I am so thrilled that you want to take charge of your health and take charge of your food.
Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now. This also extends to instruments. My son, he plays the flute, and I noticed one day that the bottom of his lip was irritated. It was always pink. He literally had a red ring, and I thought it was just because he was spitting on himself playing the flute. Now, if you watch a flautist place that blow piece, it's usually downward, and they blow into the mouthpiece of the flute. And when we went on vacation, he took a week off of practice, and the ring completely disappeared. But then when he went back to practice, the ring immediately came back, and I realized it was exactly the shape of the mouthpiece that he would lean against his chin or underneath his lips around that area. So it was a replica on his face, the mouthpiece. And it dawned on me that he was actually allergic to the metal plate because it was really a cheap nickel flute that I bought off of Amazon. So I actually informed the band director to ask if he knew where I could buy covers for the mouthpiece. I think he thought I was a crazy parent because he's never heard of such a thing. And he suggested that I take my son to see a medical doctor. Well, I gently informed him that I was a medical doctor and that is my diagnosis. He's allergic to his flute. And so I treated his skin condition just like how I treated mine I tanked up on his supplements, but I had to get rid of the instruments because that was what was causing the problem. And temporarily I put like a layer of Desitin on there so that his skin wouldn't contact the flute, but that's just not going to do, right? It's going to look white just right there, be odd and weird. And eventually I realized I just had to go and get him a new flute that wasn't made out of nickel. And that resolved the entire problem. At the time, there was no TikTok or internet or Instagram or YouTube. But now, if you search on TikTok, you'll see a ton of people with reactions to their instrument. Notice that I always use supplements when I'm addressing skin conditions because when your skin is turning over rapidly, it needs a lot of support. And you can't do that unless you have an adequate amount of micronutrients for your entire body. It's literally the last organ to be served when it comes to food and nutrition. And when I was small, my dad actually called me over and had a plate of pears. He had 4 different pears, but there's 5 people in my family. He asked me what I should do, if I should actually take a pear, because there's only 4 pears and there's 5 people in my family. I said, yeah, sure, I'll take a pear. But he actually gave me a lecture about that. And he told me that I really should not have taken the pear because there's only 5 people in our family and you should be considerate enough to leave the other pears for other people before you take your share. Now, he was just giving me a lecture about courtesy and respect as well as thinking about others. But in real life, because I was the youngest person in my house, I always got first dibs on really anything. So, I think part of it is probably because I was spoiled and he was trying to teach me to be more considerate for other people. Well, your skin is that organ. It is always more considerate for the rest of your body. It will be the last one to get nourished when it comes to your food, your nutrition, and your hydration. So if you do not eat an adequate amount of micronutrients or glucose or protein or even essential fats like omega-3 fats, your skin will be the first one to suffer because it does not have its own supply. It cannot store any of it, and it is the last one to get fed. And this is why nutrition is super important if you want to have good skin health. And your skin is literally an immune organ. I can take a look at anybody's skin and tell if they're struggling inside. When we talk about getting enough, and you have probably seen the RDA recommendation, that is based on normal people that aren't doing anything. But if you have wound healing, a peeling condition, you have eczema, you are extremely active, you're actually getting up just normally walking. I normally walk 10,000 steps a day. The RDA is not going to be adequate. And we're talking about micronutrients like vitamin C, zinc, quercetin, and even things that people haven't heard of like bromelain that have been shown to heal the skin faster. So when your skin is irritated or inflamed, it's super important to get that healed. because if you expose your dermis, then you leave yourself exposed to other complications. You have to remove the irritant. You have to just try to wash that off as soon as possible. If you're going in cold weather, you have to protect yourself from the cold. Excessive amount of UV light is also bad. So you have to look at the UV index for the day and not go out when you're 4 or above. If you're contacting any chemicals from your makeup to your nail polish, that will all irritate your skin. And then there are germs in your mouth because your mouth already comes with germs. They're healthy microbiome that keep the bad and pathogenic microbes out, but they will take advantage of the situation when you have chapped skin, broken, cracked lips. And that's where, when it's cracked in the corner, fungi start taking advantage. That's called angular cheilitis. And so the doctor is right.
Chronic angular cheilitis can be associated with a number of nutrient deficiencies like iron and vitamin B2.
When you have cracked corners, that's a fungal infection. Get a healthy dermis, and that will give you a healthy epidermis. In fact, getting your immune system healed is more important and putting antifungals, even though it's caused by common fungi such as Candida. You can buy these antifungals over the counter, but it's really healing the immune system underneath that allows your skin to heal. And if you have a Staph aureus infection, you can buy mupirocin, which is a prescription, but really, many times, topical zinc, I've seen topical zinc heal these minor issues too. But always, the underlying question is, why did that even happen? Because many people are nutrient deficient, even though they don't realize that they are. They're just simply not eating enough for their stress, or they're not eating a balanced diet. So some common micronutrients that people often miss are B vitamins, which are essential water-soluble nutrients that play a critical role in energy metabolism, brain function, red blood cell production, DNA synthesis, nervous system health, as well as your skin health. Since most B vitamins are not stored in large amounts in the body, they are really easily lost in the urine because they're water soluble. And every day, everybody needs a consistent daily intake to maintain optimal function to prevent deficiency symptoms like fatigue, irritability, brain fog, anemia, nerve and skin damage like chapped lips and angular cheilitis. Your skin relies on signals from your nervous system, and if your nervous system is broken, well, it faces a double whammy, and that's how it gets damaged even more easily. It also needs efficient metabolism and flawless DNA replication to repair and renew itself properly every day because it's exposed to so much trauma. And again, these B vitamins are water soluble, so they're not stored long term, unlike fat soluble vitamins like vitamin A, D, E, and K that get stored in your liver. B vitamins are flushed out in the urine within hours of eating them. So your body needs a constant, steady supply, especially if you're under stress, whether that's from emotional stress or physical stress, illness, or high metabolic demand, like a lot of movement in a day. B vitamins, when they get flushed out and you don't replenish it, so let's say you go on a fasting, well, you can't make up B vitamins. You have to actually eat them. They are super important in nearly every major pathway that breaks down carbohydrates, fats, and proteins for energy. And without them, your mitochondria can't function properly. There are several B vitamins, especially B1, B6, B9, B12. They support your nervous system, your neurotransmitter synthesis, your myelin sheath, the integrity of it, to allow things to go from one place to another, as well as your thinking, cognitive performance. So deficiencies have been linked to dementia, depression, neuropathy. Vitamin B9 and vitamin B12, they are essential for DNA replication and repair. And deficiency of those vitamins impair rapidly dividing cells, like your immune cells and your skin cells and your gut cells. Your vitamin B6, B9, B12, they're all essential to prevent different forms of anemia. And then you have B5 and B6. They're needed for your adrenal glands and to synthesize hormones like serotonin, dopamine, and melatonin. So really, all B vitamins are important. There are certain B vitamins that are critical to get every day. Vitamin B1, thiamine. That is vital for glucose metabolism and your nervous system. So deficiency not only causes poor skin, but fatigue, brain fog. You can even get a condition called Wernicke's encephalopathy in severe cases. And this is especially important for those who eat high carbohydrates or drink alcohol. Vitamin B2, riboflavin, is needed for energy production and antioxidant support. And deficiency leads to cracked lips, sore throat, and light sensitivity. Vitamin B3, niacin, it's required for over 400 enzymatic reactions, including NAD over NADH production. Deficiency causes dry skin, fatigue, brain fog, and a condition called pellagra, in which it can cause a syndrome of dermatitis, diarrhea, delirium, dementia, and death. And at one point, millions of people actually passed away from pellagra. Vitamin B6 is pyridoxine. It's involved in neurotransmitter production to keep your nerves healthy. It makes serotonin and dopamine. It also is important for your protein metabolism and immune function. So if you eat more protein, you need more vitamin B6. Vitamin B9, folate, that's essential for DNA synthesis, red blood cell production, and fetal development. And deficiency is linked to anemia, neural tube defects in pregnancy. Vitamin B12, that is critical for your brain health, myelin synthesis, and red blood cell formation. B12 is stored in the liver, but daily intake still matters for certain people like vegans, vegetarians, people with gut absorption problems, especially for those over 50. So when we talk about absorption, how do you know you're absorbing everything you're eating, including all your vitamins and minerals? It's really hard to tell unless you get your doctor to measure your levels. But there are classic situations in which people we already know are not absorbing the ideal amount of nutrition. And number one is if you have uncontrolled inflammatory bowel disease like Crohn's or ulcerative colitis. And when you have inflammation in your bowel, well, that is how you absorb nutrients. You're not going to absorb, especially if you're eating the standard American diet. And this is true if you know you're having a flare. And it's really important to get that suppressed. We have life-saving medications now. So see a gastroenterologist. They are specialists for inflammatory bowel disease. Now, certain people are also predisposed to have allergies that can cause intense inflammation. For example, people who have celiac disease. Now, if you have celiac, you cannot contact any form of gluten protein or you will have a flare of inflammation in your gut. And this is super important that if you have a friend who has celiac, you have to really respect that and keep them healthy. Do you know what the number one symptom of a person with a gluten allergy with celiac is? Nothing. They have no symptoms or they're not connecting their symptoms with having a gluten allergy. Instead, sometimes people are anemic and they don't know why, or they may have tingling or numbness or fatigue or itchy skin rash. It's estimated that 80% of people with celiac, they actually don't know they have it. However, the majority of people, they don't get micronutrient deficient because they have inflammatory bowel disease or celiac. They're simply not eating enough whole food, or they're taking and doing things that interferes with the absorption of the micronutrients in their food. Take, for example, antacids and proton pump inhibitors for reflux. How many of you just pop some Tums whenever your tummy doesn't feel good? How many of you do that every day? Well, you actually need acid to absorb nutrients from your food, like vitamin B12. So if you make it a regular habit, a regular routine to take daily antacids and proton pump inhibitors, don't be surprised that you're going to be deficient, especially in your vitamin B12 levels. But it doesn't just affect B12. Minerals like magnesium, iron, and calcium will also be absorbed less. Another medication is metformin. How many of you out there have blood sugar problems? Millions of people are on metformin and you're not on it for just a day or two. You may be on it for a lifetime, right? Chronic metformin use is linked to vitamin B12 deficiency, which can cause neuropathy, brain fog, and anemia. It's actually very deadly. And there are also so-called medical experts who are scientists who aren't really medical doctors to tell people to take metformin for longevity. And how many people with diabetes actually go to their doctor and tell them that their feet is tingling and they get another prescription for something else? And you don't know you're deficient until you check your vitamin B12 level. But don't just stop your metformin. Really talk to your medical doctor and ask them, could it potentially be causing a problem? Now, folate can also be reduced by metformin absorption too. And speaking of drugs, the most legal unprescribed drug is alcohol. Alcohol impairs absorption of lots of nutrients, increases the excretion of your nutrients, and damages your gut lining. So there are a number of vitamins and minerals affected when you regularly consume alcohol. That includes vitamin B1, thiamine, folate, B6, B12, vitamin A, zinc, magnesium. And let's talk about antibiotics. Every time I give a prescription of antibiotics, I know I'm wiping out people's gut microbiome, even if they need it, even if it's life-saving. And did you know that your gut bacteria actually makes you vitamin K and B vitamins? And that's why it's really important to make sure that you don't take antibiotics unless you really need to take it. So let's say you don't do any of these prescription things, but you smoke. Did you know that smokers rapidly deplete vitamins due to the intense oxidative stress that you put your body through? So you have lower levels of vitamin C, folate, and vitamin A. And how many people before Wegovy and Ozempic got gastric bypass surgery, right? Or bariatric surgery? Well, they will all be nutrient deficient, and they have to be very careful and supplement because they are at risk of both water and fat-soluble vitamin and mineral deficiency. Now, it's important that you get with your own provider to monitor your levels. And then the rest of us who don't have any of these conditions, well, if you're eating the standard American diet, you're eating too many calories and too little micronutrients. And that's usually a high sugar diet or a high fat diet. And if you're eating a high sugar diet, you should be very aware that there are vitamins and minerals that you need extra to metabolize all that sugar and starch. And there are a lot of B vitamins as well as magnesium and zinc that people are deficient in simply because they're overusing it. So all of these vitamins and minerals really are easily obtained if you eat a variety of whole foods and you eat enough of the foods, or you can simply take them as an over-the-counter supplement. And most people over 50, they're actually recommended to take a vitamin B12 supplement, regardless of their diet. But it's especially important for those who are avoiding animal products like vegans. Now, just because vitamins or minerals are essential doesn't mean that there aren't consequences if you overdo it. It's like water. You need just the right amount, and too much, well, like a flood, is not conducive for life, right? Excessive fat or water-soluble vitamins potentially can cause problems. So fat-soluble vitamins commonly cause hepatitis and liver irritation. But certain V vitamins in excess, like niacin, can cause flushing. So if you take like a multi-complex B and then you feel bad, well, it may be because you're flushing from the excess niacin, because they really don't pay attention to how much they put of what, right? People who are selling you vitamins and supplements, most of them are not medical doctors. So they really have no rhyme or reason except to follow the RDA of what to put. And potentially vitamins in excess can give you the exact same side effects that you get when you're deficient. For example, excess pyridoxine, that can cause you tingling in your hands and feet if you have too much, but it can also give you tingling in your hands and feet if you don't have enough of it. Hence, it's important not to just randomly take supplements from any manufacturer, and it's best to work with your own medical doctor. Now, as a doctor, I find myself washing my hands all the time, which breaks my skin down. And I could never find a supplement that had portions of micronutrients that I knew that would heal my skin, not give me too much, but give me enough. And the other thing is every day my nutrient requirements are different depending on my activities. A couple days ago, I walked 27,000 steps. Today, I'm barely making 10,000 steps. Sounds like there's a lot of work to do to get the right proportions of supplements, doesn't it? And I admit it does. And at one point, I was doing that for myself working during 2020. So at that point, I decided, well, you know what? I'm just going to put in one convenient packet so that I don't have to take a bunch of random pills every day. And if you want to learn more about that, click on the link below.